Home care preparation for a patient starts from day 0 postoperatively. This will enable them to learn all the care aspects throughout their hospital stay, clarify them when in doubt, and develop confidence in handling any challenges which may occur at home. There are few responsibilities for a patient and attendants to follow, like checking vital signs and weight regularly, tracking the fluid intake and urine output, taking medications correctly, doing lab investigations, and booking follow up appointment, managing diet, doing exercises, should know when to call a doctor, and lastly, preventing infection and maintaining personal hygiene. Let's see one by one. For checking vital signs, we should ask the patient to buy own thermometer, BP apparatus and weighing scale to avoid variations. The frequency of checking vital signs can be followed as per doctor's order. Weight can be checked daily once. Need to educate them about their own values to monitor the deviation, and those values should be documented in post transplant notebook and need to be informed to the transplant team if any deviations found. Next is about intake and output. Fluid intake should be maintained as instructed. Then, liquid intake and urine output should be measured accurately. For measuring fluid intake, ounce glass can be used. For checking urine output, measuring jar can be used. After measuring, it has to be documented in post transplant notebook and then should do total up intake separately and output separately. It has to be conveyed to transplant team or coordinator. Immunosuppressant drugs, that is anti-rejection drugs, should be taken as per doctor's order. These drugs help to prevent your immune system from attacking or rejecting the donor organ. Even it may be taken for lifetime. It is used as induction agents and maintenance agents. Induction agents, that is, powerful anti rejection medications used at the time of transplant, and maintenance agents can be used for the long term. Also, steroids like prednisone can be used. Any vaccinations should not be taken without doctor's order. This is an example of a medication list. This medication list should contain medication name, dosage, and reason for taking it. Have this list with you always, even while traveling. Before leaving the hospital, fix an appointment of follow up visits for investigations and checkups. This follow up visit is to track your recovery progress and detect any potential complications as early as possible. While coming for follow up, do not forget to bring your medication list and have your blood drawn 1 hour before your morning dosage of medication is due. For an example, before taking tablet tacrolimus, blood has to be withdrawn for tacrolimus level test. Diet management plays a vital role. Due to the side effects of anti rejecting medicines, diet has to be planned accordingly. Always boil the water, then cool it before drinking. Eat small amount periodically and slowly. For an example, try 6 to 8 smaller meals each day instead of 3 larger ones. Can try cold foods like sandwich, puddings, and fresh curd. There are few food restrictions. Avoid all spicy, fatty, outside food and packaged items like ready to eat items. You can snack on dry biscuits, toast, and crackers. Avoid added sugar, cheese, paneer, and fried items. Do not take fruit juices, coconut water and tender coconut water at least for the first 3 months. Do not take bottled drinks, tea, coffee, and buttermilk a day. You can have normal home cooked food and snacks, that is, steamed or boiled. Always have hygienic food. Avoid missing meals. There is a list for vegetarians: no pickles and no used oils. No fruits for first 3 months. All vegetables and pulses and also rice should be boiled or steamed. For non-vegetarians, chicken and mutton should be boiled. No seafoods are allowed for first 3 months. Egg can be boiled or used as omelette. No half boiled or encouraged. Let's see about some of the exercises. In the first week, we cannot do heavy exercises, so just do gentle exercise like breathing exercises, ankle and toe movements, and walking up to 3 to 5 minutes. Don't lift weights. You can lift only 10 to 20 pounds. In the second week, we can gradually increase the amount of walking. You can encourage to climb the few stairs up and down. Later, we can include gentle aerobic exercises. More than everything, all should know when to call a doctor. If fever goes higher than 100 Fahrenheit, if any deviation present in vital signs, if flu-like symptoms seen, example chills, aches, dizziness, nausea and vomiting, if any new pain or tenderness around the transplant area occurs, if weight gain or loss happens, if any increase or decrease in intake and output happens, call the doctor immediately. Last but not least, preventing infection and maintaining personal hygiene is also very much important. Wash your hands frequently with soap and water. Shower daily and maintain perineal care. Brush your teeth and gums thoroughly after each meal. Protect your skin from scratches, sores, and other irritations that may lead to infection. Do not go into crowded areas for the first 3 months. Visitors should be limited. Keep your house clean. Get the flu shot every year. Have a regular checkup.